Hello and welcome. The number of COVID-19 cases in India now has crossed 314,000 or 314,835 cases. Now, this is the highest for any country in the world at this point, which of course which means the history of COVID-19 as we know it. Now, the larger question is that the nature of COVID-19 as we're seeing in 2021 is a little different from 2020. A lot of younger people are clearly getting infected, but are also showing more severe symptoms than before. It's also far more infectious than it was in 2020. And again, that's something that's quite visible. But the questions that a lot of people are asking is, particularly given the infrastructure collapse across the country, the access to medicines, the access to oxygen cylinders or oxygen, and of course, the access to hospital beds and intensive care units, is what should patients be doing and at what point of time? And how do they know whether they've crossed the point at which they cannot be taking things for granted or even attempting any form of self-medication and seeking professional help? Number one. Number two, given that the infrastructure situation outside is not really conducive, then what do patients do? And to some extent, maybe the answers are fairly logical, but it's best that we put these questions to experts. And I'm pleased to be joined by Dr. Rachna Kucheria, founder of DocGenie Technologies, DocGenie Telemedicine and Technologies, and also a MD in family medicine. I'm also joined by from Delhi and Dr. Akshay, Chhallani, physician and intensivist at the Akshjyot Clinic, also with the Fortis and Apollo hospitals in Navi Mumbai or New Mumbai. Thank you both for joining me. Dr. Kucheria, let me begin with you. So there is a progression of COVID-19 that you have seen in 2020 and you're seeing today. Firstly, what's changed there, and how is it manifesting itself or presenting itself differently this time?
Govind, thank you for having me and doing this very timely and episode with really good topics, what needs to get out there. So like you rightly said in the beginning, that we're seeing a much more infectious variant. To put it in patients' words, this is what I'm hearing over and over again. My parents haven't stepped out at all from the house for over 1 year, and yet they're infected. So somehow, and the second part is that whole families are down. It's rare that there'll be 1 or 2 persons infected in a household. It's whole families that are down. And I would say to begin with, that's one of the biggest differences that we're seeing. Other things as well, and I can come to it a little bit later in the program if you like, but just launch right here. In terms of symptoms, what I'm seeing is much more a drying, which viruses do, but a drying of the mucous membrane passages. I'm pointing to it so people understand. They'll complain like, there's a lot of drying, like something is stuck here. There's a constant niggling here. And then people will do different things to mitigate that. But this is actually the virus acting up. And the number 2 other most common symptom theme that I'm hearing is a lot of weakness. Even in young, very fit people, who are sports people, play and exercise daily, making a cup of tea could be hard for them. And I talk from my own family experience where 4 people are down.
Right. Okay. Dr. Chhallani, tell us about what you're seeing this time, and if at all, what are the key differences in both demographics, the youth demographics as well as the older demographics?
Yeah. Thank you very much for having me with you. Coming to the answer, basically as compared to last year and this year we are seeing more younger patients. Actually, the age group which we saw the last year were more in the 5th or 6th decade, but this year we are seeing the people on the 3rd or the 4th decade. That is one major difference. Second difference, last year we did not see too much of fever lasting for 1 week or more than 1 week. Last year the fever lasted for 2 or 3 days and the patient landed in the hospital or they did well. But this year, by and large, in last 2 to 3 months, we are observing or we are seeing the patients in which the fever lasts for more than 1 week, 7 days, 8 days. And after that, they do recover, or some of the people who are more having comorbidities like diabetes or hypertension, all that, they land up in the hospital. These are the 2 major differences which I can observe. And the third thing, now we have the grip of the situation. As compared to last year, we are in the better position to treat because we know what is the nature of the disease and the course of the disease.
Right. Okay. So let's come back to those first few days, Dr. Kucheria. I think you gave us a good start point. You talked about that, that feeling, that scratching in the throat. Now, what happens after that? And, how does it progress day by day? And at what point do many people seemingly maybe either don't take the next right step or lose control?
Okay, just to piggyback on the previous point and Dr. Chhallani's point, absolutely right. The fevers are longer this time. I would say even up to 10, 11 days, 10, 12 days. So, in the end, I hope we go over some succinct messaging that people shouldn't panic. So the progression, usually it's starting with a very mild sort of what we call, doctors call URI, upper respiratory infection, a term for all kinds of viruses, maybe possibly once in a while a bacteria that all of us have faced, this little and, the burning, as I talked about, a little bit of cough, a little bit of feeling of being unwell. And I say that in a pandemic, that should start raising alarm bells right away. Alarm not in terms of panic, but go isolate. And hopefully we come to this as well, that, with the system and the whole system, even the testing system collapsing right now, symptoms, early recognition of symptoms should be the new testing at this time to mitigate, the wave that we're in. We cannot wait just for test results. And that should be a very important message. You start feeling these symptoms, isolate. You are going to infect other people. So starts with this, maybe a little bit of fever comes on, fever progresses, fever could start becoming worse. It could hit 1 or 2, 1 or 3. And then usually I find in a couple of days, for most people, the fevers also start coming down. One has to be patient through this time, look for other red signals to be able to decide that patient is okay to be kept at home and ride through the fever. And then the fever does, in most cases, come down, as I said. The other problems, you said, what's the progression? The weakness, body ache may progress. That too starts to reverse in a little while. The whole symptoms of URI, the cough, this dryness, again may progress. Some amount of feeling of a little bit of heaviness in the chest. Again, we have ways to mitigate that. If people lie on their stomach, lie on their chest, it gets better. The crocins are improving the fever. So all those start happening. And as long as we have some amount of, we call reversibility in our language, that, it's getting better, either with medicine or with doing something, you're safe. We'll come to oxygen monitoring, I hope, a little bit later, but I've just taken it from the patient's point of view right now. This is what they are facing. A small minority of cases, small, not large, are also having gastric symptoms, nausea, vomiting, and diarrhea. But it's a small minority. I think one should focus on the 80-20 rule, and 80% are coming with the upper respiratory.
Right. So, Dr. Chhallani, let me pick this up with you. So, would you concur then that for the first 5 days, let's say after you experience the first round of symptoms, nothing much can be done and perhaps even should be done?
Yeah, first 5 days, basically what we need to do, mostly are symptoms like fever, weakness, and all that. At any point of time during this, suppose you find that other parameters like pulse is okay, BP is okay generally. Pulse in the adult we see around 60 to 100. Now in every day we see the pulse oximeter at everybody's house. So at any point of time the pulse is in between 60 to 100, you don't worry. But anything which goes above 100, there is a red flag. The oxygen level now we monitor, coming to the point, but if it goes below 92 or 93, there is a red signal. And what I suggest everyone, even if you have a mild fever, even if around you there are a lot of patients with the COVID, at any point of time you start any medicine, please consult a doctor. Don't do any self-medication. So it's not always possible that you had a COVID. There may be other things also in addition to the COVID or instead of COVID. So don't assume that you had a corona or COVID infection and start self-medication because some your friend or some your colleague has received this medicine and you don't start that. That's two points. And regarding that, what rightly said my previous speaker, actually, whenever the oxygen level goes down, in case now there are a lot of issues with the bed, for that time being or till you get the bed, try to sleep on the prone. What I mean to say in the prone medical term, that generally we lie down on the back. So you lie down on the stomach, ulta. That is the medical term you label as a prone. So till you get a bed, you try to sleep on the stomach actually.
Right. So you said that there are other conditions which could also be leading to the same symptoms at this point of time. Could you tell us what you have been seeing or have seen?
Yeah, specifically coming to the Navi Mumbai, basically in addition to fever because of COVID, other like dengue fever or other viral infections, tuberculosis and other things are also there. So don't assume that you had a fever that is COVID only. So basically to rule out other infectious diseases like dengue, malaria, typhoid fever and other non-specific viral fever which are other than the COVID actually.
Right. Dr. Kucheria, so the heaviness, which could also be breathing, linked to breathing and lung, does that usually show itself along with your the feeling of discomfort in the throat, or what's the time difference that you usually see or have seen?
So good question. And I'd like to bring about this WhatsApp joke that's going around that you see every symptom except for pregnancy and fracture with COVID. And, I know we'd like to really slot it in these, what's the first 5 days and what's the 7th day. Unfortunately, it's not like that.
Okay.
We always talk in terms of most, because this virus, as I said, has us on our knees bent, the entire globe. So if somebody started out with the mild symptoms and they are continuing day 4, day 5, generally one is seeing, I tell people, rest assured, you've had a good start, it will stay this way, because panic and fear, I hope we talk about the mental health issues also, is something that we also have to address side by side. That's really important. And for others, with a bang, the second, third day, in fact, they may start getting respiratory, shortness of breath, difficulty breathing, the oxygen may be dropping to 90, 91. That may happen within the first few days. It's a minority, but that's what I'm saying. There's no timeline. That may start in the first 2-3 days even. So one essential point takeaway from this is that a pulse oximeter, like Dr. Chhallani also said, is now essential home equipment. Every home, most homes normally have a thermometer. But this has become essential home equipment. You have to have it, cannot wait for it, because it may be the differentiator between you being able to stay home and being sent to the hospital.
Right. So, which is coming to the point about going to a hospital. Now, you're right. And I think that should be emphasized, that two patients are alike, and no symptom progression can exactly be alike, while obviously it might be similar. So if the patient reaches a point where clearly it looks like they have to be taken to a hospital, which could be anywhere between, let's say, 4 to 8 days or 5 to 8 days, what happens then? And what do you recommend, particularly at a time like this?
So this is the hard. Sorry, was that for Dr. Chhallani or me?
No, go ahead, Dr. Kucheria.
So this is the really hard part right now. How many no's one is having to say and do. In my practice, remember, our patient pool is different for Dr. Chhallani and me. I'm a community health physician, a GP, and he is a hospitalist and intensivist. So, who comes to us is different. So small percentage of my patients, thankfully, are needing hospitalization. And if these red flags happen in my home care situation, or even if I'm sensing they're happening, because I do mostly telemedicine now. And so one other modality is taken away, although I will say it's a great modality during COVID times. With the face and with training, with experience, there's a lot you can pick up. So if I find that they're looking sickly, they're feeling sickly, the breathing issues of any kind, just even while talking, I find that there's a little bit of effort involved. Of course, the data that they can see, the oxygen is down, the temperatures are spiking high, that in combination with everything else. If these start happening, then one does recommend, or they're vomiting so badly they can't keep anything in. And sometimes even just a sign that I'm feeling just so sick and miserable, I'm feeling horrible, that also is a good indicator, and it should not be negated. So, being able to thread out the unnecessary and the panic from actually the physical symptomatology the patient is facing is an art and skill of a physician. And when you start seeing those red flags, at that point you say early in the course rather than later messing around, please start looking for a bed. And then in the meantime, certain other things can be done, but please start looking for a bed. This is really important.
Right. And let's come to the three things: the oxygen, beds, and medicines. Remdesivir being the most popular, let's say, go-to medicine for patients, because either it's prescribed or maybe in many cases not prescribed. So, Dr. Chhallani, at what point should oxygen suffice and should you start sourcing it? And at what point should you be actually thinking of and even starting to prepare, as Dr. Kucheria said, to get a bed in a hospital?
Yeah, unfortunately now that is the reality, that patient needs a bed, and it's very difficult to get a bed very easily. And most of the part where I practice, actually it is very difficult because number of beds and the patients are very disproportionate. So what I suggest everyone, those who require a bed, they need to make enough attempt to find a bed, not one first hospital, go to the second or third. What I suggest, some specific people or some patients I have seen, they are strict that I just want this hospital only, I want just this hospital only. So don't be very categorical about the hospital, because by and large now government of Maharashtra and all over India, there is a protocol for a fix for all the COVID positive patients. So by and large the treatment is same. What you need to do till you get a bed, actually, you drink a lot of water, because if you see the COVID, it will create a dehydration in your body. It is a procoagulant state. So what I suggest everyone, till you get a bed, you drink a lot of water. That is first thing. Lie on the abdomen, lie on the stomach. And as a medical personnel, what we those who are stable patients, those can be managed at home, we don't hospitalize those patients. That we can do as a medical personnel. And regarding the remdesivir, actually, we found, or the medical literature is very clear, that it will decrease the viral load, but it will not change the mortality. So don't be in a sense of guilt or in a sense of assumption that your patient did not get remdesivir, so he's not going to lie, he's not going to survive, or he's not going to do well.
Right. And what about oxygen? I mean, so a lot of people are looking for oxygen as well. So should oxygen be, is it a substitute for going to the hospital, or is it something that you need to now arrange for even as you go to hospitals, because hospitals themselves are running out of oxygen?
Yeah, coming to that question, it's very, very in the gray zone questions. It is not, if my suggestion and my take home message, if you require oxygen, better you are not at a home. Because oxygen is the only component. It's, you don't know how much is the pulse, how much is the BP, what is your breathing pattern. Suppose you're breathing very heavily and oxygen is normal, that's bad. And if your oxygen is normal, but oxygen is little bit border, but your breathing is comfortable, that is okay. So what I mean to say, only numbers are not important. In addition to your breathing pattern, oxygen level, other parameters are also important. I don't suggest the person to take oxygen at home as and not going to the hospital. The fact that you require oxygen, it's better that you are in the hospital. Now the issue is that whether you should keep the oxygen at home, keep the oxygen cylinder at home. My suggestion is that you keep it home, but you make enough attempt to go to the hospital if you require oxygen. This shouldn't happen that oxygen at home and then you don't make attempts to go to the hospital, because the fact that you require oxygen, that means you may be in trouble.
Right. And that's an important point. And also that, oxygen, as you said, is one input, and only a hospital or a hospital bed or an intensive care unit is a place where, trained professionals can monitor every aspect of your body's functioning, all of which needs to be working well at the same time. So, Dr. Kucheria, your thoughts from, again, your interactions on, those who are taking remdesivir, what are you telling them? And of course, oxygen, which everyone is trying to now arrange one way or the other.
Right. I agree with Dr. Chhallani completely that this whole panic and guilt around remdesivir needs to go away. We have experience with antiviral drugs, and they usually just work very well in the first 2-3 days. A common example is acyclovir. People might have heard the name, used in herpes. So it's good if it's used in the first 2-3 days, but remember, it's not cutting mortality. That's what we saw in the trials. If it was of any use at all, maybe just cutting some hospitalization days. To have so much panic and guilt and madness running around for this, where our energies could be focused elsewhere, I think is a bit much. So the correct messaging on remdesivir needs to go out there, number one, and people need to know that we still don't have a drug that kills coronavirus. Lots of cocktails are being tried out there, but we don't have the evidence-based data that this is actually good for coronavirus, like we have drugs for malaria or something else that, or for a sore throat, which is strep. We don't have a drug. So a lot of cocktails have been being given and used, and some very dangerous ones that one is seeing. So please stay away from this, and also support your practitioners by not harassing them that your treatment is not working, we're still having fever. That's the part of the illness. How many times we get this, and over messaging, it's still 100. Remember, we are all stretched to the limit. We are all in our jobs. I'm sure Dr. Chhallani is, and many of my colleagues are constantly triaging. The sickest one is getting our attention first, and then if you have a little bit of fever that's going on, okay, right now it's war. Support us. Don't be pointing fingers that your treatment is not working. There is no treatment. No one's keeping anything away from anybody. There isn't a treatment. If we had a drug, trust me, it would be our job to give it to you first. But we don't, especially as a person who manages patients at home, I don't want to give you unnecessary side effects. You're okay at home dealing with the symptoms of COVID, fine, we'll keep a watch, they will get better. Now, I don't want to give you 3 other drugs that you're going to have start having side effects, and then I have to look for a bed of that. How is that good anyway? So people, please get this clear that we do not have a drug for COVID. Dr. Chhallani, please back me up on this. In the outpatient setting, remdesivir doesn't reduce mortality, just a bit of hospitalization. So really eating well, home-cooked food, hydrating, like he said, liquids, being prone, being with a little bit of peace and joy, meditating, making yourself less anxious. This is the best you can do. And if you're in the care of a doctor, you've reached out to somebody, be frank with them, help them assess you for danger signals, and then appropriately start looking for a hospital bed. Let's all work in this together. We cannot afford to hog this hogging mentality that we have generally not working.
Right, and I'm going to come to Dr. Chhallani for a sum up as well, and then back to you again. But before that, Dr. Kucheria, so you talked about mental health earlier, and I mean, panic is not a mental health aspect per se, but I mean, if you're generally maybe prone to panicking, reacting with fear, then obviously things could get worse. One, are you seeing more of this? Two, is there any way that you would suggest people should, I mean, is there a line or two or something that people should do to first compose themselves before, dashing off to either buy medicines or block beds in hospitals?
Right. So I think having support systems, which is, I think, what we are very good in India with, many of us stay in 2 or 3 generation families, we have support, cousins, all that. And we are a culture that comes together when people are sick. In times before COVID, nobody went to the hospital alone. There were always 10 relatives. So, getting that support system in place virtually, phones, this, that, most people have that now, making sure you have people to talk to calm yourself down, having those strategies in place, because it is very hard. No one's denying that, especially if you're going into isolation or another family member is. 1, you have the illness. 2, you're in isolation. 3, you're hearing horrible news from, from all the channels, and even otherwise, if not channels, even on your phone, WhatsApp, university is sending you oxygen khatam hai, ye hai. So sure, I mean, it's a huge thing to stay calm. It is, but let's make that a goal. Whatever it takes, right. If it's prayer, meditation, whatever it takes, if it's the support of other people, and other people also need to come together as small communities. Have your RWAs set up volunteers who will call people who are alone. This sort of thing can be done more in a grassroots community level than large, everyone's rushing off to big hospital, this, that. We can support each other. If there are small communities, hey, in my community you can get this medicine here, or these labs are still open and they will come to your house, or let me arrange this for you. I think that's how communities need to come together and mitigate some of the panic and anxiety that's with this illness.
Right. Dr. Chhallani, last word from you. The couple of things that people should be doing. One is to prevent and ensure that they don't get it. And if they do, then what would be your sum up as things stand today at this point of time?
Yeah, bottom line, what I want to say, you get vaccinated as early as possible as per the government regulation. We hope and pray you don't get a COVID, but even if you get a COVID, don't become so panic. The mortality is very less than around 1 or 2%. You recover from the COVID, please continue using the mask, please continue using hand washing, and keep a safe distance. This is the message what I want to give to everyone actually.
Okay, Dr. Kucheria, you want to add to that very quickly?
Really quick, if you do get symptoms, I will differ a little bit here from the previous speaker. If you have the symptoms we talked about, act as if it's COVID, isolate, get in touch with a doctor if you can, isolate in the meantime till you can get tested, try not infecting other people, and don't panic. The danger signals we've already gone over, oxygenation, how you're feeling, and most people do fine. And to add to the vaccine bit, this is one thing I'm seeing on ground in my little, study of people that I've seen, that if you've had the vaccine, all of them have stayed home. no one has been had to send to the hospital, and these are senior citizens. And also one more caution, if you're going to get the vaccine, make sure you have N95. I cannot tell you how many people have come back after the vaccination have had the illness. So I'm pretty sure that they've got it at the center, being enclosed, waiting for that half an hour, whatever, not wearing proper masks. So it has to be N95 if you're going in for a vaccination. You have to wait the half an hour there.
Right. Dr. Kucheria, Dr. Chhallani, thank you very much for joining me. I do wish you and your teams all the very best in this fight against this virus, and also to speak to you soon. Thank you.
Thank you very much.